Welcome to the bright lights of Las Vegas, as this is HIMSS 2018, as we introduce you to our proud Commonwealth Alliance members. Scott Adams here with you. Time now to turn our attention to Bridgehead Software and their Senior Product Manager, Mr. Tim Kaschinske. And Tim, what is Bridgehead Software's real area of expertise, and how do you guys envision your contribution to improving nationwide interoperability?
Well, Bridgehead specializes in making a document repository, and specifically for clinical documents. And our intent is to make those documents available to whoever needs them. So we work with sharing documents throughout a hospital system, and that allows us to get legacy data, for example. A lot of times legacy data gets put into our archive, our repository, and we're able to share that along with the current EHR documents that already exist. So sharing data is kind of what we do in a document format.
So Bridgehead and CommonWell, why? Why the partnership?
It kind of expands on what we've been thinking in terms of we do this within the hospital. CommonWell allows us to take the documents that we have and expand that sharing of those documents to other people within the CommonWell network. It works perfectly for us.
How does Bridgehead define data interoperability?
Data interoperability is different from, say, system operability, where two systems can communicate. Yeah, they can communicate, but are they communicating effectively? You know, like two people, one talking Spanish, one talking English, they're not really communicating. Data interoperability is where you're actually communicating. You know that, for example, the identification of a patient is accurate, and that's actually the patient's document. And then further, it's a radiology document, and it's a radiology report for a CT scan. The more you know about it, the more data interoperability you have.
Got it. And how is Bridgehead driving the interoperable solutions within the industry?
With us, what we do is we use a lot of standards. So we use standards such as HL7, DICOM, XDS, and soon to be FHIR. I know that CommonWell is adding FHIR to theirs. We're looking to do the same thing. So following the standards that exist in healthcare helps us be more interoperable with other systems.
He's Tim Kaschinske as Bridgehead Software, now 2 years into the Alliance. And for more on Bridgehead Software, we implore you to log on to CommonWellAlliance.org. Thanks so much, Tim.